Do y'all know the difference between an ER patient and a floor patient? So, an ER patient is somebody that's like in the emergency department. When you first get to like a hospital and you're in some type of crisis, you go straight there so that they can like try to figure out what your crisis is, and if it basically passes the level of scary to where it needs to go up to the floor and you get admitted. So essentially the difference between an ER patient and an admitted person is that a admitted person, we've already ran the test and you actually qualified to be in the either the intensive care unit or in telemetry, where we're like managing whatever like issues you got going on. And it's not like definitely major to where you're in the ICU. So ICU patients can get transferred to telemetry because now we done stabilized you. Now you feeling a lot better, and you done upgraded somewhere on the floor. But ER and floor is completely different because the floor, remember, is the ICU, the telemetry. There are other departments too, like labor and delivery, but we just sticking to these basic ones so that we can help distinguish what an ER patient is versus a floor patient. So yeah, the ER patient is the one that we're running hella tests. We're running all the tests. We trying to see everything. We want a clear understanding of what's going on in this person's body immediately. So basically, that's when we run the rainbow, which is the red top, the blue top, the gold, the green. We're just trying to figure out what's wrong in this person's body, and then based off those results, it'll determine whether this patient is, we can manage them here in the ER, or no, this patient is in a critical status and needs constant maintenance of treatment, and we can basically hold this patient here. They need specialized care. Specialized care is on the floor, like they need the intensive care unit, or they need I'm managing this issue that's going on. So yeah, so those are the different options when it comes to a hospital. Are you ER worthy or are you floor worthy? Did you graduate to the floor? Because everyone steps into the ER, and from the ER they've determined if they're graduating to the floor, which means they have either something that's very detrimental, like hey, they need surgery, or hey, we need to put them in ICU because now they need to be on a breathing machine, and it's just like they have other issues that can only be addressed by specialists, or they are about to have a baby, so they can't have the baby here in ER, take them to labor and delivery, or like there's a newborn, well, babies and pediatrics is different, so let me not dive into that one. But yeah, so I hope this explains to you what like an ER patient is and what a floor patient is. The ER is the emergency where the first steps, we're trying to figure out what's going on. And then based off what's going on, you graduate to the floor and then you get that specialized assistance. So yeah, have you ever been to an ER, and how did you feel being in the ER? Did you feel rushed? Did you feel like you were getting like quality service down there? Like, and if you did feel rushed, did you feel like they met your needs immediately? Did you feel like the rush caused you to have like prolonged pain or a delay in care? Like, explain to us how those two experiences like shaped your view of a hospital. If you were in the ER and moved to like the floor, explain how moving to the floor, what type of services you received. Did you receive better service in the ER, better on the floor? Let's yap about it in the comments.